Hi, everyone. Welcome to today's Facebook Live event sponsored by Euclid Systems. We're really excited today to be able to chat with you regarding the state of what is happening with Ortho-K during this time of the COVID crisis and what is happening out in the field with a couple of clinical experts to be able to participate today and share their wisdom with us. I'm Craig Norman, and I'm really very pleased to be able to introduce you to, first of all, Dr. Ariel Sorenzi. Ariel, how are you doing?
All is well here. I'm in North Carolina, in Charlotte, and just trying to, stay busy as much as possible.
Okay, that's great. So, Ariel, of course, I've had the opportunity to know you for a few years after you graduated from University of Houston and then College of Optometry, and then spent time at UMSL in your residency, and have now embarked upon your clinical career, as you had just mentioned. And we know that you have an interest in myopia management, and we're going to be discussing that today. Our other guest is Dr. Kate McClure. Sorry, Kate,
That's all
for
right.
mumbling that, getting those words out of my mouth. Kate is from Columbus, and she's a Buckeye all the way,
Yes.
as far as her undergrad and her optometry school, and now in her postgraduate work. Kate, how are you doing today?
I'm doing really great. Thanks, Craig. I have a private practice here in Columbus, Ohio. I'm shared partnership and we're doing really well. I'm trying to keep, like Ariel said, as busy as we can and helping our patients out as much as we can in the meantime.
Okay, that's fantastic. So the theme of what we want to discuss today is primarily what's happening within Ortho-K and what is going on within your practices relative to that, knowing that each of you is either not working very much or not working at all for this period of time, just like most of optometry at the moment is in exactly the same boat. And I'd like to begin by exploring, if we could, how you are managing the Ortho-K patient over the last few weeks, and primarily, how you're communicating with both the patients, which are kids, and their parents. And if we could, Dr. Sorenzi, can you tell us what's been going on?
Sure. So as of March 20th, I was temporarily laid off from our small private practice, and our owner is seeing, some of our urgent and emergent patients. So what I wanted to do is I wanted to communicate to our patients that are in orthokeratology, especially as there was a lot of information released about contact lens wear in regards to it being safe during this time. So as we're all getting inundated with emails about COVID-19, I sent an email out to our patients specifically in orthokeratology in kind of a little bit of a different fun format, where I recorded a couple of videos talking about the CDC announcement, how it was safe for contact lens wear. I discussed the fact that, it's very important now more than ever to maintain proper hygiene with, good hand washing techniques. I had a separate video on how to use ClearCare properly, and I had some ClearCare at home, and I just kind of walked them through the cleaning regimen. We just got a new puppy, and so I showed the kids the puppy just as something fun for them to stay engaged with. And I enjoyed doing that because I know a lot of these parents have a lot of concern for their kiddos, and just kind of wanted to give them a peace of mind in a little bit more of a fun, engaging way.
That's terrific. Actually, in a really novel way, if I should say so, communicating with the kids, is, their life is video. So what better way to be able to communicate with them relative to that? And Dr. McClure, how about yourself?
Yeah. So I'm currently a little bit more hands-on. I am the doctor in our practice seeing all of our emergency care at the moment, all of our urgent follow-ups. So, we have postpone some of our Ortho-K dispenses and things like that. So we had a bunch of patients, a nice number of patients that we were getting ready to dispense. And unfortunately, we had to postpone those. Any patients that are currently in orthokeratology, if they have any emergent issues, we are absolutely there to see them if problems arise. Mostly I've been answering questions via phone call and email for patients, trying to make myself as available as I can. We do have staff members taking calls throughout a condensed time period during the day. So that's been really great because patients can directly call our office and get a person on the line. And then I'm there in office too to answer any urgent questions that come up. So we've made sure that all of our patients know that we are still here. We are actively taking calls, actively taking concerns, and I'm just going out of my way to make myself available for patients. I'm also on call. So, I had a call last weekend. A parent said their child broke their Ortho-K lens, and I said, I will get that to you ASAP. So even over the weekend, I'm making sure that someone is available for these patients when they call in and need us.
Well, you actually bring up an excellent point on how one can manage lost or damaged lenses.
Yeah.
And so I'd like to explore that a little bit with you. In a case like that,
Sure.
So you ordered the lens from the vendor. Did they ship it to you? Did they ship it directly to the patient? Did they go to the office?
Yeah.
How did that happen?
That's a great question. So right now we are shipping all lenses directly to patients. That minimizes the amount of people handling or touching the lens, and it gets it to the patient, a couple of days sooner rather than having to come to my office and then ship out to the patient. So we are making sure that all lenses are shipped directly from the lab to the patient, and the parents do really appreciate that. Anything that we already had in office. So we had a couple of lens orders that came to the office kind of in that intermediate time, and we immediately got those shipped out. I think, after the day or two after our office technically closed for routine care. So we've made sure that anything in office was sent out, and then anything that gets ordered is directly sent to the patient.
Okay.
And the great thing is vendors have been really, really great to work with, especially Euclid. They're making it really easy for us to do that for patients.
Well, and in fact, they've instituted some policies, is what I understand, to be able to work with practices like both of yours to be able to manage these lost and damaged lenses. So really, I think that is fantastic. And then Dr. Srenzi, are you doing anything different there if that situation, whether you've either had to address it or what your plans are in case it does come up?
Yes, we've been doing the exact same thing, just shipping directly to the patient to minimize as much contact as possible. And like Kate said, parents are really appreciative of that. Okay.
So did you in the past, let's say 3 months ago, did you ship lenses in Ortho-K for Ortho-K directly to patients, or did you always have them come to the office?
We mostly had them come to the office. Yeah. What about you, Ariel?
For us, I think it was, really kind of dependent on the situation. If it was a patient that's been established to Ortho-K for years and has always had minimal, if at all, any changes, then we'll ship it to them. And if it's something that's a little bit different of a scenario where we want to just double check that everything is still, the fit still looks good, the vision is still good, then we would have them come in for sure.
Okay. Because that is a bit of a change, specialty lenses, we always wanted to have come into the office and we wanted to see the patient. But when you get right down to it, you basically handed them lenses and somebody in the office did, and you may or may not have actually looked at them on the eye. So I think that this direct delivery to the patient from the laboratory, probably will be one of these things that comes out of, this past couple of months that changes the way that we end up practicing. Dr. Srenzi, have any parents voiced any concerns about their kids managing their lenses or wearing their lenses, not managing them? Because for the younger kids, frankly, the parents are managing it anyways. But are they continuing to wear them as often, or do you think any kids have gone to wearing their glasses in the interim, or are the parents really wanting them to continue on in the same way of overnight wear?
So one thing I wanted to make sure in that those emails that I sent out is that the parents knew that that I was always available virtually, even though I wasn't going to be physically at the office. And so I've had a couple of parents reach out to me and say, oh, good, we have continued wear. Thank you for just confirming that that's okay. I did have one concerned parent FaceTime me right. I guess it was a couple of mornings ago where the child had dislodged the lens on their bulbar conjunctiva, and I just kind of walked them through how to, get it off of the eye safely. But that's really, that's really the bulk of all we've had. All of the parents have been very receptive to the information and have felt good about continuing with contact lens wear.
Yeah. I think in general, parents of young children that are in orthokeratology are definitely involved in their day-to-day activity, even more so than parents are in general, because of the use of the lenses. And so I think that ability to communicate with the parents, like you just said, and the child, I think is really wonderful. Kate, do you have anything to add to that?
Yeah, we've been emphasizing to our patients that contact lens wear, as long as it's done appropriately, is still safe. Ariel and I were talking about this earlier, but the CDC recommendations say that, no, contact lens wearers aren't at increased risk as long as they're using them as their doctor has prescribed and, with good hygiene. So I think we're trying to emphasize that for patients is, your Ortho-K is a treatment program. So you need to continue it during this time for the treatment to be effective, for the eye health. So we've really been emphasizing that, yep, you need to continue this treatment. And I think too, during this time, it's really important for all of our patients and parents to try to have as much of a normal routine as possible. And your contact lenses can be a part of that. So we're trying to make sure they know if they have problems, we're here for them, but keep it part of your routine. It'll help with your orthokeratology management and your myopia management.
Yeah. Well, both of you are blessed. You have tremendous communication skills and in general, and I'm sure with your patients, it's exactly the same way. Dr. Serenzi, if I could ask you, have you had to address with any parent of an Ortho-K lens or contact lens wearer in general, some of this news that has been coming out that it's safer to wear eyeglasses right now, so you aren't touching your face versus contact lenses? And in particular, the mixed messages that the public is getting, that one part of the profession says no contact lenses, the other part of the profession says that's crazy. Of course, you can wear contact lenses. Have you had to address that? And if so, how?
Yeah, so that was one of the things that I did address. And there were a few articles that I saw. One of them was on Helio about how, wearing eyewear is something or glasses is something that would be safer. But, Kate and I were talking about this before too. I feel like when you're wearing glasses, you're touching your face a heck of a lot more than you are with your lenses, your contact lenses. So that's what I communicated to the parents. I also said, right now we have no idea how long this is going to last. If this virus came from seemingly one person and it affected the whole world, this isn't going to go away anytime soon. So just like Kate said, it's a treatment, and we can't go 6 months, a year without you having this treatment. So it's important to continue it for the child's long-term eye health.
Mm-hmm. So in your offices, are either of you involved in staff training at all, as far as, letting them know what the new products are, letting them know how to handle things, letting them know what new lens care is, all of that stuff? Do you play a role in that at all? If we could start with you, Dr. McClure.
Yeah, so I do a lot of our orthokeratology and our specialty lenses, and I love training staff about these products, and they love learning about it. And that's something that we're looking to do at our practice here in the future. We know that optometry is going to be different And we're assuming that, we are going to be slowly introducing patient care. So how do we keep our staff members busy when we probably don't or can't have the patient volume initially? So we're trying to implement ways that we can train and teach our staff. So that's something that at my practice we're actually looking at right now is, okay, how can we engage our staff when we can use this opportunity to really expand their knowledge, because we might have some time to do that. And when you're in a really busy practice setting, you don't always have that time. So, hopefully we can take advantage of some of that, train our staff. And I think that a lot of the companies and industry partners have a lot of great tools that we can use. Tools that are for patients can also be great to train staff members. So I think that we're going to be utilizing that a lot, so that staff can be more and more involved in some of these specialty lens care and training.
Well, of course, it's so important because in many cases, the staff interacts more often with the patients than the doctor does. And so having the staff being able to communicate in that fashion is really critical. And to do it in the words of, for instance, the two of you, is coming out of the patient's mouth instead. Dr. Cerenzi, are you doing anything different there?
I think, more so emphasizing hygiene is going to be something that we will strongly focus on. With the economy the way that it is, suffering from COVID-19, I think it's probably going to be maybe a little bit more of a financial barrier for patients to consider their children doing this, because it is, more expensive than if they were just to do regular old eyewear. Sure. So some of the training that is important is to just kind of train your staff that yes, it is a cost, but it's something that is just so important for the future of this child's eye health, and not to be afraid to talk about it, especially at this time. And now more than ever is the time to educate the staff on the importance of myopia management and the importance of getting people that need it in it.
Yeah, that's just an excellent point, because the myopia doesn't stop whether one can afford it or not afford it. The train leaves the station and it's on its way. And if there is going to be some intervention, whatever it might be, in trying to be able to manage it, it needs to be done as soon as it possibly can. My sense is most practices, and may very well be both of yours, will just get a little more creative on financing or directing patients how they can be paid for. You've noticed that there's a lot of creativity right now in financing everywhere by everybody, and trying to make sure that consumers, in our case, patients, are able to acquire whatever they actually need. If I could, Dr. McClure, can you just weigh in a little bit on pre-COVID? How did you communicate with patients? Did you have a concerted marketing effort? Do you use Facebook? Sure. Do you use other social media outlets? How do you manage that?
Absolutely. We like to kind of think about, the time period in which our patients, that patient population might be coming to see us. So we see a high number of children and young adults in the summer when school's out. So we like to kind of focus our energy on getting these orthokeratology patients during that time, because you can be really smart about it. They have the time to do it. The kids have the time to adapt to the lenses and to adapt to the correction. So we really try to emphasize starting orthokeratology in the spring and summer when the children have that time, and the parents maybe have that time to work with their kids a little bit more too. So we definitely focus our energy on that. We also have a myopia management clinic, which is really exciting. So we try to funnel, all of our patients that are interested and need myopia management into this clinic. And in this clinic, we discuss, the options that we feel are best for the child. And if the child is really excited about the chance to wear contact lenses, we absolutely, if they're a good candidate, bring up Ortho-K every time. So we really try to make sure that the parents understand the options for myopia management, what they can do for their children. So we dedicate a whole appointment to that. What can we do to help your child? And if they're interested in contact lenses and a good candidate, then absolutely emphasize what orthokeratology can do for them. And it's something that's exciting. If you approach it like, hey, there's this great technology that I think your child would be a really good candidate for. The parents get really excited about it. So we try to really emphasize, this is really cool new technology, well-established technology, but it's something different that I think your child could really benefit from.
Yep. Both of you are excellent on actually not just communicating, but teaching the parent and the patient what's going on. And I think that that's really what differentiates any medical professional from another is, do you actually have some kind of bedside manner to be able to talk to them about the things that are of interest, rather than spending your time just looking at the EHR and not communicating with them at all. And I know that Ariel Sorenzi, you had shared with me that you've been involved in instituting, internal, external marketing in the practice also. Can you share some of those thoughts with us?
Sure. For our internal marketing, one of the things that we did that we really love is when the child is on their 1 month successful orthokeratology follow-up, I made these little handmade cards that say, congratulations on your new eyes. And then they open it up and it says, we want you to see a movie on us. And we give them a movie gift card. And we just kind of talk about how cool is it you can go see a 3D movie now without, having to put those glasses, the 3D glasses over your glasses. And then we have a little referral card in there that if they refer a friend over to us, that they'll get, such and such off of however much money you decide on off of their next year's visit towards the contact lenses. So that's an internal marketing strategy. We certainly need to up our social media game like Kate's practice. So that's something that we're looking to do. For external marketing, Charlotte has a Chinese academy where all of the Chinese children go to on weekends to kind of learn a little bit about their culture, their language. I've done a few lectures there. I've done a few lectures at libraries. If you do CE at your local optometry society and let them know that this is a specialty that you're passionate about and that you do, maybe you could get referrals there. And then just trying to get into contact with local school nurses and really educating them on myopia management, because they see children wearing glasses, and probably increasingly so if they've been in the industry long enough. So those are some of the few things that we have done that's been very successful.
Okay, that's great. You know what, from what both of you guys are saying, it reminds me of a friend and colleague of mine, Nick Despeditas from New Jersey, has a really premier ortho-K practice. And one of the marketing techniques that Nick would do is that he would rent out a movie theater. And you mentioned movie tickets is what reminded me of it. And he would rent out the movie theater just for his patients. And he'd invite each of the kids, and the kids were allowed to bring one of their friends and one of their friends' parents. So it was a very private thing, but it was really designed for all these Ortho-K kids to interact with each other and all the Ortho-K parents to interact with each other. And it was just a brilliant, marketing scheme to do it.
Yeah.
He also did share with me once that he had tried the roller skating, but once a couple of kids fell and he thought there was a broken arm or two, he forgot that idea for the future and would not try that again. So maybe more the conventional route.
That's cool.
Would make some sense. So as we get ready to close here, if we could, Dr. McClurg, do you have any comments about what you think you will be doing different now with your Ortho-K patients, with these young children and their parents, as we get into the reentry phase here in the next few weeks?
Absolutely. So I think everybody is really worried about safety and, disinfecting and sanitizing, and that seems to be the focus, is how do we keep everyone healthy and safe? And so we're really going to emphasize that orthokeratology is still safe. I use a lot of hydrogen peroxide solutions, but emphasize, hey, you know what, this has been proven to be safe and effective solution. So emphasizing, the proper way to clean, and just really, really making sure that our patients are aware. So making sure the patients have resources about healthy hygiene habits for their contact lens wear. So we always emphasize it, but I think even more now, we really need to make sure that parents and patients alike know exactly what to do with their lenses. And every time they come in for a follow-up visit, kind of emphasizing that. I think it's easy to look over, especially at follow-up visits, like, hey, you cleaning your lenses, like any problems, but making sure that the child and the parent, both know the proper way to clean them. So, right. And emphasizing to a backup pair.
Yeah.
I think that's really important, is emphasizing the need to, hey, you know what, let's get you a backup pair so that if something happens and you're at home and one cracks, you already have one. And so those are the things we're going to try to focus on, is cleaning and the importance of having a backup pair.
Okay. That's really, really terrific advice. Dr. Srenzi?
Yeah, I love that, Kate. I agree with all of that. I think with, telemedicine becoming more of a, more accepted and, exciting thing that we're doing with our profession now, we can incorporate that into some of our ortho-K follow-ups, not in looking at the fit, of course, or topographies and slit lamp, because that's so important, but more so just the patient feeling comfortable in contacting us, and making sure that they're doing things right. And if they have any concerns, it seems as though maybe people feel a lot more comfortable reaching out to us doctors in kind of a telemedicine type of way. So I'm excited to see what the future holds with that.
Okay, that's really fantastic, and both of you are such breaths of fresh air, relative to our field. And I'm so fortunate to have met both of you when you were in the resident phase of your career, and to watch it develop. And for both of you, it's really fantastic to see what you're doing now that you're clinically involved. And I know, Kate, you're still on an academic path also, but I mean, in general, both clinically involved. And really the insight that you're supplying to the field already this early in your career is just fantastic. And really, I want you both to really keep up the good work.
Thanks, Craig.
We learn from the best.
Appreciate it. Yep, that's right. Thanks, Craig.
That's really nice of you to say. I was wondering how long it was going to take before you did. Anyways, but thanks to both of you so very much.
Thank you.
Please,
thank you.
Be safe.
Thank you.
It's a weird time for all of us. Be safe. Be healthy. That unfortunately we won't be standing around like GSLS like we were recently.
I know.
It's going to be a little bit of time before that happens, but I look forward to being able to do that with both of you again. And for those of you watching, I would like to let you know that next week on April 21st at 1:30, I think it is, in the afternoon, we have Dr. Joe Berardi. Joe is the acting CEO of Euclid and is going to share some of his experiences as an optometrist and as a CEO in the eye care field. And he's really got an interesting story to tell. And I hope everybody would take some time to listen, and we'll be able to learn at that point also. And if you have any comments, you can continue to make them on Facebook while watching this particular episode of being able to communicate with patients when we're not in the office. So thank you, everybody, so much for your time, especially our two guests. Keep up the great work. Thank you.
Thank you, Craig. Thanks for having us. We appreciate it. Thank you very much.